If you have recovered from COVID 19 but are still experiencing some of the symptoms, you could have what is known as post COVID condition, or sometimes referred to as long COVID. There have been reports in some countries that long COVID is a common trait of the Omicron variant of the coronavirus, which is the dominant strain here in St. Kitts and Nevis and other parts of the world. Former Chief Medical Officer Dr. Patrick Martin believes focus should be paid here in the Federation to patients who have recovered from COVID 19 and may be experiencing long COVID.
I just saw some data out of the European Center for Disease Prevention and Control says that 1 in 10 persons are affected in some way with symptoms ranging from fatigue, muscle aches, joint pains, heart inflammation, forgetfulness, numbness, tingling in fingers and toes, almost any organ affected by persons who have recovered from COVID, from the infection itself. So these are signs of injury to organs and tissues. So is it a direct effect of the virus? Is this an effect of an autoimmune phenomenon in which the body turns on itself? Or is this an effect of treatment? These questions are being elucidated, and we'll get more information in time.
The Minister of Health in Guyana has reported cases of long COVID there even weeks after persons who would have been discharged from the hospital as having recovered from COVID 19.
Post-COVID, some of them can exhibit the symptoms of diabetes. Others who have had diabetes post-COVID, they can have some challenges controlling their blood sugar. The variant was predominantly infecting the lung. So persons were having difficulty breathing even after they would have left the hospital. So they were cleared from COVID, they didn't have any other complications, but they still had some difficulty breathing, especially if they tried to walk up steps or do some physical exercise. They were having these challenges. We have also seen that there are patients who would have had changes to their heart, and some of them would come back with fast beats in the heart or palpitations. Some of them would have breathing problems, and that's as a result of the heart beating too fast. Others would have chest pains, severe chest pains that mimic myocardial infarction or a heart attack.
Dr. Martin said the systems of reporting of incidences of long COVID currently exists within the public health apparatus and should be used in this regard.
Physicians and nurses have to be on their lookout, have to maintain a high index of vigilance in the face of persons presenting with complaints that are consistent with what is called long COVID. Their system already exists before COVID. It is usual and customary for practitioners, medical, dental, nursing, to report anything that is unusual or unexpected to the Ministry of Health, to wit, the Office of the Chief Medical Officer. And from time to time, the said office would put out advisory guidance as to what to look out for, especially if something flares up in a neighboring island or a country within the hemisphere. So that is the norm.
Some of the most common symptoms of post-COVID 19 condition include shortness of breath, cognitive dysfunction, which people call brain fog, as well as fatigue. Those are the three most common, but there have been more than 200 symptoms that have actually been reported in patients. The Health Ministry has not reported any incidences of post-COVID 19 in St. Kitts and Nevis to date. Andre Huey, SKN Newsline.